My name is Mia Maysack. I live in Wisconsin and I'm 30 years old. And this June, I am commemorating my 20th year of living every day with pain inside my head. It's not a dietary or lifestyle issue, stress, the fact that I'm a woman, or a result of me not doing absolutely everything I can within my power to be well. I was a kid when struck with this, an incurable, lifelong traumatic brain injury, and I wish I could say I'm unique in this regard, but I speak to you today representing millions. Honoring this pandemic as well as Migraine and Headache Awareness Month, as a constituent, American, person, and patient, I'm going to kick it to you real as well as point out some discrepancies. Firstly, it further pains me that supporting policies and improvement of access to innovative treatments is something that we must request. Most recently, I can point out the fact that we were granted oxygen tanks for a short time in the midst of this crisis, which is the only side effect-free option for cluster headache that I personally know of. CH is merely one type of pain that I experience and is nicknamed, not by me, as suicide headaches, in case you didn't know. Yet, despite continued advocacy toward overturning the denial of home oxygen coverage, no such luck. There's been no legitimate explanation for this, and nor could there possibly be, to justify taking something that has proven to work away from those who need it. And that's a trend in health care we aim to stop. As a direct result of step therapy, in order to continue being seen or even taken seriously, it was necessary I jumped through a countless amount of hoops, including but not limited to having to retry options that had already proven unsuccessful or even problematic before being considered for other approaches. Because of non-medical switching, a treatment I had received every 3 months for 15 years, with no reactionary issues at all whatsoever. By treatment, I mean an average of 30 injections into my head. Yes, that's how desperate we are for relief. It had been swapped out for something cheaper without my being aware. And because of adverse reactions to the ingredients that I didn't even know I was getting, I now experience more head pain, along with other lifelong incurable conditions. Why is it that we're able to be seen for the writing of a prescription drug, but the idea of incorporating massage, water, other therapies, or means of self-help are disincluded by any sort of insurance reimbursement or coverage? There was a point that I was banned by the only head clinic in my town due to missing too many appointments in a calendar year. Getting a phone call back from a provider, let alone leaving a message that actually makes its way to them, has been borderline mission impossible throughout my vast experience. And there hadn't been much of any consideration throughout the traditional realm about my circumstances, no effort to make anything more convenient or even a remote possibility. I felt the medical community had turned their back on me during a very difficult time, and the system has done nothing but add insult to that injury ever since. Alas, seemingly overnight, telemedicine has become common practice, which is great. We're fortunate to have the technology. But the fact it has been so clearly demonstrated to what accommodations can truly be made, we are going to demand them to continue. When visiting Capitol Hill to plead these cases in person, ordinarily I ask whoever I am meeting with to imagine having just stubbed their toe, to think back to their worst ever hangover or flu, reflect upon their most heinous injury or even a bad sunburn. And then I request them to picture themselves in that situation on a recurring basis, as my attempt to provide a tiny fragment of insight as to what everyday life is like for me, by relating it to something more common that others have already been through. But this pandemic, in a sense, has ensured that I'll never really have to do that again. Because COVID has confronted us all with the fact that mental health is a thing. And given that there's now a better global understanding of concepts such as isolation, loss, overwhelming emotions, discomfort. There's again no legitimate explanation nor justification to evade these aspects of a patient's care. Suffice it to say, when your head hurts all the time, it proves difficult to keep thoughts straight. Just the everyday tension headache is enough for most to agree that's not something they want to encounter regularly. And if that were your norm, it is enough to push anyone over the edge. We continue to lose beloved members of our community on a regular basis because all of this tests a person's will in ways no amount of words can explain. So what is my ask? It isn't a question so much as a statement. This is a call to action to follow through on your oath to public service. We need to know those in office are there looking out for us and protecting our rights, and it needs to be acknowledged, declared, demonstrated, and set as standard that profit is not more important than human life. Thank you.